My name is Andreas Gomoll. I'm an orthopedic surgeon in the sports medicine division at HSS, and my thing is knee surgery and joint preservation. Most of the patients who come see me have knee or shoulder injuries. They might be sports related in terms of they had an acute injury while playing sports. Sometimes it's really just over the years damage has accumulated. So it's not one traumatic event, but it's sort of been bugging them for years. I also need to know what your expectations are. What does your life look like? What do you do for work? What do you do for hobbies? That really has a surprisingly large impact on the treatment decisions. When we treat orthopedic problems surgically, we can either do what's called keyhole surgery, so arthroscopic surgery, where we just make tiny little holes. I look inside with a fiber optic camera, and then we can, with tiny instruments, oftentimes fix things without big incisions. There's some problems that need bigger answers, and for those we do what's called an open surgery, where we make an incision so that it can get in and replace part of your knee joint, not necessarily with metal and plastic, but sometimes with biologic replacement options. So in terms of where can we see each other? And historically, HSS has been on the Upper East Side. Manhattan is a great place, but it's not the greatest place if you come in from outside Manhattan. So we're trying to make things easier. So we have opened several satellites, and the satellite I go to is Stamford, Connecticut. This is a Chelsea pier. We have a great rehab center, we have imaging, and we have physician offices. So you can see me here at the main hospital, you can see me in Stamford. The best thing really at the end of the day, if you have a long clinic day and you see a lot of patients, but if somebody says, you know what, I can do things I haven't been able to do for 10 years, thank you, it's the best thing.